Good afternoon. I came in this morning, I told Eric, feeling like I was batting in the pitcher spot as the last speaker of the day, but it's been a long day, and now I actually sort of feel like I'm the person who's what's called the Red Lantern, who's the slowest rider to finish the Tour de France. So in any case, I'm the only speaker standing between you and whatever your plans are for this evening. What I'm going to do is actually, I think, directed in large part at the folks from the various other CDRNs who are in the room today. And I'm going to talk about and really try to connect some of the dots that we've been discussing all day, which is really about the relationship between governance and sustainability. I came to Kaiser and to this world of inter-regional, inter-institutional research about 5 years ago after 20 years in academics. And so I've really spent the last 5 years myself really learning from the ground up what it means to do multi-institutional research. And I've done that in a number of ways, through Kaiser Research Governance, through participating in various activities of the HMO Research Network, and as a scientist running a large 11-site diabetes network that has electronic health record data on over 1.3 million individuals with diabetes. So I've learned about this as a director, as a person involved in governance, and as a researcher, and different lessons in all those areas. So what I've tried to do is as I've been this sort of friendly observer of this process of interinstitutional research, is to do a lot of sense making. And I think my first message for us this afternoon is that transformation of the research enterprise, which we all agree needs to happen, really requires a transformation of governance. And the words that we use to talk about that research transformation, all of them have governance implications. Research studies need to be bigger, which means we need to include more sites and subjects, and to understand and develop and make more efficient the scientific and financial relations among them. Research needs to be better, which means it needs to use trustworthy, high-quality data and better analytic methods while achieving or while maintaining regulatory and fiscal compliance. It needs to be faster. We need to get more quick at initiating studies, conducting the business contracting processes, and as we talked about at some length, human subjects review. It needs to be cheaper, so we need to rely not just on data we collect primarily in the course of large randomized trials, but on data that's collected during the course of routine care. And last but by no means least, I think the thing that PCORI has really led us to emphasize more and more is that it needs to be engaged, in that we need to integrate both the patient and the kind of organizational perspectives that we've talked about today. But we're also more engaged with each other as interdisciplinary and interinstitutional scientific teams. So what's the connection? I think that my second message is that I think skillful governance is necessary to promote sustainability of these enterprises. And I've just been thinking through a paper that I've written with Eric and others about what sustainability has meant over the 20-year history of the HMO Research Network and the longer history of Kaiser Research. And I'm going to actually propose a sort of an operational definition of sustainability, a two-part definition. The first part is that sustainability has to do with the development of shared research assets to facilitate one or more studies in a specific content area or multiple areas. Second, it has to do with developing a community of researchers and other stakeholders who reuse and develop those assets. Part of it's about the technical assets, part of it's about the people and the culture. The governance of those actually is somewhat different, I think. The governance of the technical assets requires a lot of attention to detail, the language of BAAs and data use agreements, the details of a data model or the data quality. Whereas the governance of the community, the second part of the definition, requires, I think, much broader processes and I think a very light touch, and I'll talk about that a little bit more. So a way of summarizing this, I think, is that governance of inter-organizational research requires two things. It requires us to develop precision tools on the one hand, but also to allow, really, to permit the creativity to use those tools in new ways. So let me unpack the notion of sustainability a little bit more and talk about the first part of the definition in terms of research assets, what I think of as precision tools. The organization and governance of the network itself needs to be well defined. We've seen governance charts, org charts from various organizations today. Those relationships among institutions need to be clarified. That's not synonymous with what we oftentimes focus on in governance, which is actually governance of the data. That has to do with discussions about the data model you use, how you ask questions of that data and of the sites that hold it, as well as a whole long list of issues around assuring the quality and validity of that data. There's a lot of knowledge about data, but there's a lot of knowledge about other things as well, which is about tools and approaches to obtain informed consent or to administer surveys or to do a whole range of other technical tasks that have to be done well and efficiently for this kind of research to work. A long list of things having to do with administrative efficiencies, time to execute contracts, and the like. Sometimes extensive governance of physical assets is necessary. The classic example these days, I think, would be biobanks, specimen repositories. And finally, to be sustainable, these networks really need to develop and sustain predictable infrastructure funding. Now, each of these has a drop-down menu of issues about governance, and time won't allow to go into all the details there, although I'm certainly happy to talk about any or all of these things when we get to the discussion section. But oh, okay. And I'll just, then I'll go through the second set of essential elements. The first is a shared set of mission, vision, and values. Mary just showed us very nicely hers from Health Partners. I think of the protection of human subjects even increasingly as not just a regulatory obligation that we need to fulfill, but really these people are our stakeholders. We're including them as employees and colleagues in our research, and thinking about their values and how to advance them is really a part of what we do as a community of researchers, particularly those of us who are embedded in healthcare organizations that have broader missions. Developing and maintaining strong relationships with the delivery systems, which are also our stakeholders. I think we've spent most of the day actually talking about that in some detail. And I think lastly, but not least, is the developing a culture of leadership and collaboration between the entities in these networks that's based on fair and transparent decision making. And as I said, I think each of these has a whole long list of governance issues that deserve consideration to help make these networks sustainable. Let me give you just two quick examples since I have a limited amount of time. In terms of the sort of technical area of diversified infrastructure funding, I think when you do research across institutions over time, you rapidly learn that single projects such as the hallowed NIH R01 really rarely add substantially to your infrastructure. That requires identification of a whole range of resources for infrastructure support. And looking at the 20-year history of the HMO Research Network, I'd really characterize that as a relay race. And here are some of the projects and networks that have passed the baton, if you will, from over time. The CDC has funded vaccine safety research for over 20 years. The National Cancer Institute has funded our Cancer Research Network for 15 years. AHRQ, NIH, various NIH institutes, the FDA, you know, all the different federal agencies have funded infrastructure and projects in different content areas over time. And my point here is to say that to achieve stable governance of a research network, you need to be able to adapt to different PIs, different lead institutions, different scientific priorities, and a whole range of varying pressures and incentives. Governance structures need to be flexible enough to adapt to the legitimate needs of those projects, while also being inclusive enough, I guess, to gather the learnings from each of these independent networks and to try to sort of collate them into some organized whole so that you develop common models of analyzing data and the like. And I think the other lesson that's been learned is that even these infrastructure investments, which have been extensive, are not sufficient. And certainly our research network has never become independent. I think is unlikely to become independent from institutional support. The organizations that we're embedded in really have a role, and we've talked about a lot of the ways that we can add value to them along the way, in addition to adding value through the research that we conduct. Let me say a word about leadership, because I've spent 5 years learning sometimes difficult lessons about that. I think that the culture of leadership and decision-making in research networks really can be characterized as one of leadership without control. These organizations are decentralized. It's hard to impossible to enforce top-down mandates. There's a lot of emphasis on consensus decision-making. And there's a real need for trust. When you're leading organizations of creative people, you really have to trust their capacity to self-organize and innovate in many respects, rather than sort of giving them constrictive guidance about what they should do. I think of this, as going back to freshman chemistry, as these organizations are linked by hydrogen bonds rather than covalent bonds. And for those of you who don't remember freshman chemistry, the covalent bonds in a water molecule are the bonds that link the hydrogen atoms to the oxygen. But it's the hydrogen bonds that determine whether water molecules are going to join up as ice, the ocean, a cloud, or a snowflake. That's all determined by the nature of those hydrogen bonds. So even at the sort of most rudimentary level, I think these seemingly less tight linkages are perhaps ultimately more important to the form that things take. How does this all come together? I've had the privilege of working for Kaiser for the last 5 years now, and many of you may know, but Kaiser has 7 regions across the country, and each of those has its own research department, and those departments report regionally rather than centrally to the program office. We've long had a National Research Council that includes the regional directors as well as leaders from program office. Ray Baxter, who's sitting here, is actually our executive sponsor. And about the time I joined Kaiser, we developed our first strong research strategic plan that we just recently reviewed, and it's actually held up well over the last 5 years. And this plan led us to do a number of really significant things. The first is to establish a Kaiser Center for Effectiveness and Safety Research, which started going in 2009 and really got rolling when Beth McGlynn joined us in 2011. And this, in turn, has really enhanced our conversation. It's made more systematic, our conversation with organizational leaders, both within the regions and within the central program office of Kaiser. CSER, the Center for Effectiveness and Safety Research, has heavily invested in building a data coordinating center, enhancing our data model and data quality. In the last 2 to 3 years, we've had increasing conversations and the use of metrics, as I mentioned earlier, among the 7 IRBs of these, and through this, and with our HMO and department partners, we've also developed an inter-IRB relationship that allows us more effectively to lead and seed, if you will, across different kinds of studies. One of our absolutely best decisions was to develop a council of our research administrators who tackled the thorny problems in terms of contracting, pre-award, post-award work, all the things that really bog us down in an environment where we need to be more nimble in order to execute on task orders and contracts within a 12 to 24 month time horizon. And all those have really facilitated new initiatives. Kaiser just committed to the establishment of a national KP biobank, the goal of which is to have both clinical information and biological samples from 500,000 members of Kaiser Permanente. And much of the work of that will be greatly accelerated by the discussions we've had around how funds transfer, how governance is done, how data are used and protected, and so forth. So all these different pieces really come together and enable us to look at new initiatives in ways that I think are quite exciting. So here's my conclusion. I think part of governing interinstitutional research is something that people have said many times today, which is you want to make the right thing to do, the easy thing to do. And that's true around the technical aspects, around data privacy, around contracting, around many of the technical processes. But I think the other thing that I think of in leadership as a real cautionary note is a classic sort of Taoist precept, which goes, ruling a big country is like cooking a small fish. Too much handling will spoil it. Thank you.